Slip discs or bulging discs are conditions that can affect the spinal discs, predominantly or most commonly in the lower back down here, the 4-5-S1, and then in the neck as well, generally the mid to lower portion of the neck. And slipped or bulging discs can be considered as a more layman's term for a minor strain to the disc. And this is where the disc is under pressure and injured, but not quite herniated. And there's a separate video on herniated discs, so watch that one if you're interested. Slip discs essentially are caused by excessive compression through the lumbar spine or the cervical spine, and that irritates the disc, creates inflammation. Now when we have inflammation in somewhere like the ankle, from a minor strain or twist of the ankle, you note that the inflammation balloons the ankle in a very short period of time. We try to take pressure off the ankle and allow it to heal naturally. Normally this works quite well, maybe with a little bit of aid and a little bit of icing. In the lower back, however, the inflammatory process is going to be exactly the same around these slipped or bulging discs. The problem is, in the case of the lumbar spine, there's a very finite space where this inflammation can build up, and it's within a bony boundary. And this is quite commonly why you can get things like sciatica associated with slipped discs, or trapped nerves in the case of the neck that go down the arm. It's because this excessive inflammation in response to the disc injury takes place in a small geographical location with limited boundaries. One of the effective ways that we treat slipped discs here in the clinic is really a four-pronged approach with additional rehab to enforce that. The first part of the treatment is to get the tissues to start healing better and reducing the inflammation. For that, we use laser therapy directly over the source of the slip disc or the location of the slip disc, either the lower back or the neck respectively. We'll then do spinal decompression or IDD therapy. This is a fantastic approach to directly take pressure off those slip discs. And if you think of these slipped or bulging discs like a water balloon rather than a thing that's slipped out to the side, as you compress the water balloon, it bulges to the side. And by stretching that water balloon, you take pressure off and the balloon becomes skinny again. This is a particularly effective way, using the IDD therapy, to unload those compressed, damaged, bulging discs. The next two treatments are a little bit more about addressing some of the additional factors. Often with slip discs, extra pressure's gone through this disc because other sections of the spine are not taking their fair share of loading. So we do specific adjustments to other areas of the spine to alleviate the pressure and mobilise stiff joints. And this works quite painlessly. It's very, very effective and very easy to have done as a patient. The final part is the vibration therapy, which is often rather pleasant for patients as well. And with this, we work on the muscles. A lot of cases, slip discs and bulging discs are misdiagnosed in the early stages as being simple muscle spasm. With any injury, because of the pain and the reactions and reflexes that inflammation evokes, you get a degree of muscle spasm. This is not the problem. However, if we've got compressed discs down here in the lumbar spine or in the neck, and we have muscles that are contracting further, they're going to make that compression worse. They're going to aggravate the problem more. So doing vibration therapy over these muscles here, down into the legs where necessary, or across the shoulders and in the neck muscles up here, can really help to alleviate some of those additional problems by way of reducing the muscle spasm. And that's sort of our 360 approach. To learn more about this treatment, then do have a look on the rest of this page to see how we treat slipped and bulging discs in a little bit more detail. And remember, if you think you might have a herniated disc, a more severe variation, you can check out that page on the What We Treat page too.